My name is Dinali Fernando, and I am the Medical Director for the Libertas Center for Human Rights at Elmhurst Hospital in Queens, New York. So the work that our Human Rights Center does is really focusing on individuals who've suffered severe human rights violations or torture in their home countries for a whole host of reasons. It could be because of their political opinion, their race, their religion, their ethnicity, their gender, membership in a social group. And so what we do at our center is we really provide them comprehensive care, which is medical, mental health, legal, and social services to really help them to rebuild their lives, to gain independence and to contribute back to our society, because a lot of these individuals are really incredible individuals, really resilient. And what they were being persecuted for oftentimes is the work that they were doing back in their home countries, which was advocating for the rights of their own people, and got persecuted for that. So they have so much that they can give back to our communities if they just get the support that they need to go through their process of healing after all that they've endured. So I'm originally from Sri Lanka, and I came here with my sister to go to college. And coming from a developing country and having seen really the healthcare disparities between the developing world and the developed world, it was my intention always to contribute back to that community, to the underserved, in some way, shape, or form. And so throughout my education and my training, I've kind of had that always, kind of at the forefront of everything I've done. Really wanted to do global health work, and so I got involved in doing global health work in grad school, and then also in medical school and residency. And when I was a resident, I had two mentors, my attendings at the time, who were the two individuals who started the Libertas Center. And they started it as a volunteer program, and they asked any of us residents who were interested in doing this type of work to work with them. So I started working with them as a resident, and then I was exposed to this particular population. And then just seeing how incredible the patients themselves were, and the really unbelievable experiences that they had had, and their ability to recover, and our ability to help them in that process, and how impactful that can be, is really what kept me with this work and kept me motivated to continue doing it. So my particular specialty is I'm an emergency medicine physician, and this program was started out of the emergency department. And the reason it was started out of the emergency department is because we're based in a public hospital, which is a safety net hospital, and the community that we're in is largely, almost exclusively immigrant. And so there's a large number of individuals in our community who are undocumented, and the hospital exists so that these individuals can come to the hospital and get medical care and health care, even if they're undocumented, even if they don't have insurance, because it's a public hospital. It's for anyone who needs care. And so the thought was that survivors of torture, they don't speak the language, they don't have access to health care, they're not going to know how to get connected to a clinic, even if it's not an emergent health need. So they're going to walk in through our ER dose, which is exactly what we found when we did the studies to evaluate for that. However, being an emergency room physician particularly, I have to say that one of the challenges is we're in a really busy emergency department. We have incredibly 90,000 patients a year. Any given shift, you're running around the whole ER. You're seeing on a 12-hour shift, you might see up to 60 patients. So one of, I think, the real challenges is finding the time. We're very focused on what a patient comes into the ER for, just for time reasons. And when you're working with this population, you have to go a step above. You have to ask a few more questions to really identify them as torture survivors. And really one of the challenges for me and other providers working in such a fast-paced setting is having the time to do that, and learning the skill set to do that effectively and quickly in a sensitive way. Because I think the key is if we can identify them in the ER or even in the clinics, which are really, really busy, if you can do the first step, it's just identifying that this is a torture survivor, and if you can connect the patient with a program such as ours, where we have the time to spend several hours with them to really address all of their other needs, that's already doing a huge service. But it's really getting the training and the mindset and learning the skill set to do it effectively, sensitively, very quickly. And I think that's a challenge that can be overcome, but it's having the time. So I feel really fortunate because Elmhurst Hospital, because of where it's located, because 71% of the residents of Elmhurst are foreign-born, and similarly between Flushing, Corona, and Jackson Heights is between 62 and 68% foreign-born, one of the most ethnically diverse neighborhoods in the country. I think the hospital, the administration, and the providers throughout the hospital are very, very aware that this is the population that they're serving. The majority of our patients throughout the hospital don't speak English. We need interpreters for, the bulk of our patients require interpretation. So I think inherently providers who are drawn to working with this population are the ones who come to Elmhurst and who stay at Elmhurst Hospital. And the administration is very aware of this, and so they've really incorporated cultural sensitivity. The staff at the hospital come from very diverse backgrounds, have a huge language capacity amongst them. And I think that's really, that says a lot, because not just the language capacity, because they all come from different cultures, they're inherently aware of the cultural differences. And then in our training with our residents and our medical students, that's really incorporated about understanding different idioms of distress or different ways that patients might or might not express their pain and their symptoms. And that's a very important thing for us as clinicians to learn for our program and in general, because for example, I hate to stereotype, but we found that with the older Asian population, they don't complain of pain. They can have 3 bones fractured, they're very stoic, because culturally in that day and age in their countries, that's how they were raised. So we have to be extra sensitive about asking them, do you want pain medication? That's really incorporated into the training, because the administration and the residency program directors and the leadership recognizes that that's a key component to providing adequate care and effective care for our clients. So a lot of the research work that we've done around the human rights work has really been looking at program evaluation and really looking at what works and what doesn't work for our clients. How can we better improve our program and better improve our services? And we've looked at it in terms of how are the resources utilized, and now we're looking at how is resource utilization by our patients affecting their outcomes. And so we're in the process of trying to publish a lot of the data that we've had. We've had 1 or 2 studies published in the literature, and then we're in the process of putting the rest of it out. But we do have some preliminary data on our website, and also, if anyone wants to learn more, happy to talk with them if they contact us. So I think there's multiple folds, but if I had to break it down, I would say 2 big components to that. The first is really having institutional support, and that's key, because having your leadership from the top up support you in what you're doing is really what you need in order to be able to start a program like this. We are a grant-funded program. However, we get an incredible amount of in-kind support from both Elmhurst Hospital and Mount Sinai Hospital, which is our affiliated teaching hospital. And without that level of support from the top up, we would not be able to do the work. So really having buy-in from your leadership, I think, is really, really key. And secondly, training and education. I think that's a second really big component, because we get grant funding for our center, but we don't work in a vacuum. We work within this big hospital, and we can't work in a vacuum. So in order for us to effectively do our work, for us to get referrals from throughout the hospital, as these patients are getting care all over the hospital, and similarly as our patients in our center, they don't just get care at our center. They go, we get them services throughout the hospital. In order for them to get effective care, culturally sensitive care, for providers to be trained in how to work with the complex needs of this patient, education and training are key, and that has to happen at the attending level, the resident level, medical student, nurses, all your ancillary staff. And so I think the second biggest component really is training and education, and that has to be on an ongoing basis, especially in a teaching hospital where you have a lot of turnover. There are several people who have had really an impact on my life and an impact on my leadership style. But I would say it starts with my parents, and starts with my dad, who always saw the best in people, who was very collaborative, really went out of his way to help everyone. And he always instilled in me, if someone is if someone is not acting right or doing right or something is not right, don't just judge them. Always try to find out what else is going on, because we're all human, and when people are not acting as you would expect them to, because they're probably having other stresses in their life, to take the time to understand that before you judge them or get upset with them. And both my parents have always instilled in me, be kind, because they always said, you know, you can get an education, you can get money, you can get rich, but if you're not kind to other human beings, you know, that's what life is really about. So in all that you do, whatever you do, be kind. And then my mentors, I've had really amazing mentors throughout my training. I've been really fortunate at multiple levels, and my two mentors who started the Libertas Center, I mean, I really hold them in such high esteem, because they are individuals who do the work for the work. They don't do the work for fame, they don't do the work for glory. They're so humble and down to earth, and they do the work because they want to help the patients. It's not about what they gain from it, but it's what they can do for the patients. And just seeing that kind of leadership style, I've been fortunate to have all of them as role models to really impact and influence my style of work. Because what really keeps me passionate about this work is the patients who we work with. Despite the incredible adversity that they've gone through, really the unthinkable atrocities that they've had to face, really inhumane at every level, they rise above it, they survive it, they make their way here. They still have hope, they have so much resilience that they don't even recognize that they have, but the fact that they've made it through multiple countries, lost family members, seen their family members tortured, and they've still made it here, and they still have a smile on their face, to me is amazing. And really seeing the fight in them, even if it might not seem like they have a fight in them, they clearly do, because they've made it this far. And seeing their determination and their hope and their resilience is really what makes the work worth it. You know, because they're incredible human beings that I think all of us who have the opportunity to meet them are really privileged. We are privileged to have met them. If I wasn't a doctor, I think I would be either in the field of public health or social work, because I think those are two fields where I believe that you can have a really profound impact on a very large scale, on an individual level and a large scale. My last words would be for all of us in the healthcare field, or in the social work field or legal field. If you have the opportunity to identify these survivors, consider it a golden opportunity, and it's really our responsibility. If you're the person, the first point of contact for this patient, it's your and our responsibility to help them get connected to services, because they might not encounter a professional who has the ability to do that for quite a while because of language barriers, cultural barriers, not having access to resources when they get here. So if you have that opportunity, take that opportunity. It might not seem like you're doing much, but if you can get them connected to the right services, you can change their lives. So just bear that in mind and take the time, even if it's a few minutes, to do that. Really fortunate to be introduced to the Gold Foundation as a recipient of this year's Pearl Birnbaum Hurwitz Humanism in Medicine Award. And with the award that's going to be later this evening, I was informed by Gold about the Plaintree Conference on Patient-Centered Care. That was very fitting with the type of work that I do, and they asked if I would be willing to speak at the conference.